Joe Feeks, editor of Poultry Health Today, and with me is Dr. Billy Hargis from the University of Arkansas. Billy, thank you so much for joining us today.
Thank you.
And you have a very long title. You've got several titles, but the one that interests me most was the one about sustainability. Can you tell me about that one?
Well, sustainability means a lot of things to a lot of people, and I think a lot of people that are dissociated from agriculture, both historically in terms of generational gap from the farm, that they have different concepts than I do in terms of what it takes to feed the world. And the world population is continuing to grow. The arable land potential for further cultivation is disappearing, and yet agriculture is going to have to produce a lot more food over the next decades to be able to sustain the human population. And at the same time, it's about the environmental footprint that's caused by agriculture. And then some people start to think that there's a bad name. Agriculture becomes a bad word. And how that happened during my lifetime is beyond my comprehension. It appears to me that everybody eats and everyone has to eat. And yet agriculture becomes a bad word. And I'm troubled by movements that are so-called sustainable, where they actually increase the environmental food footprint. They increase the amount of grain utilized to feed animals for animal protein production.
Can you give me an example?
A lot of the free-range and organic production, in my opinion, really, we see in our world, in poultry, for example, we see much higher mortality rates in free-range and organic production than we do in confinement production. The amount of land that's actually used for the animal production is greater, and in many cases, the row crops, the grains that are fed to the animals to make meat or eggs that are, from an organic perspective, much less efficient. There's much more land cultivated for the same number of eggs, for the same pounds of meat that are produced, and that's not sustainable in my mind. And we have issues, with the free range and organic. I think there's an issue sometimes that people look at confinement production for poultry, broilers, for example, and meat-type chickens, and they think these animals are too crowded. And yet I've been on poultry farms when there were fan failures and they've opened the ends of the houses. The chickens don't move more than 10 feet outside the house. And there may be 20,000 animals in this space, and yet they don't migrate away from it when they have open access voluntary. And it's one of the problems with meeting free-range requirements for meat-type bird production is the birds don't want to go outside if they give them a choice. And then there's a movement that, well, that's because you genetically selected them. And, well, indeed, they've been genetically selected for improved efficiency, for better feed conversion, for better growth rate and better livability and fewer disease problems. Tremendous genetic selection. That's sustainable. That's the direction we should be going.
And also, but you mentioned mortality too. I mean, if there's higher mortality, it becomes an animal welfare issue too, doesn't it?
It is for me. It is for me. That brings into the question of the ability of a veterinarian to prescribe antibiotics, for example, to a sick animal. There's an ethical issue for a veterinarian to not treat an animal when legal medication is available to treat a sick animal. And to watch these animals suffer and die from lack of access to available and legal drugs that are safe and effective, it's difficult to watch for me.
So what's next for sustainability and poultry health?
Well, if I knew the answer, I would probably be rich because I would play stocks, but I think that a lot of people are looking at an area called prebiotics, things that are not digestible by animals or humans, but that promote beneficial microflora within the gastrointestinal tract. There's some evidence that may be a direction that will be effective. There's interest in an area that's called nutraceuticals that are basically bioactive plant extracts. Some evidence that those might be useful. And some probiotics have been demonstrated to be useful. And there are several new and emerging technologies with vaccination strategy and therapy, either therapeutic or prophylactic vaccines for a number of diseases that are on the edge of being released. And which of these are going to be the most adopted? I guess my guess would be vaccines will continue to be a very, very important player, and I think that we're going to need more vaccines, more vaccine selection to be able to select for serotypes and etiologies that are causing problems here. And I think one of the things that we worry about is that pathogenic organisms, under the pressure from vaccines, tend to split in terms of what's called serotype.
Right.
And the immunity to the vaccine is no longer effective for what's out there in the field. And because of development costs and regulatory costs, it's hard for vaccine companies to keep up with the serotypes that are available. And in fact, many of these become orphan diseases because there's not quite enough of it to justify the cost of production and regulation to get these vaccines on the market. That's an area that we're trying to find some different ways to address. It's going to be a hard one because if we keep the same regulatory standards on vaccines, it's going to be difficult to find a pathway where you can cost effectively prevent certain diseases by making almost custom vaccines, what used to be called autogenous, or still is called autogenous vaccines. And there may be a shift in that direction toward more licensed autogenous vaccine production. I think ultimately there's going to have to be a change in regulation with vaccines. We're going to be dependent more and more on vaccines. There are several.
Why is that, do you think? Why would we be more dependent on vaccines?
Well, we're losing the chemicals. That's very unfortunate to me because some of the chemicals that have been used are absolutely safe. There are no residues in the beef, and there are no resistance issues for those chemicals that are of human clinical significance. These are classes of molecules that are never used for humans, any human disease.
And when you say chemicals, are you including
Antibiotics.
all antimicrobials, which include antibiotics as well?
Yeah. Anticoccidials, antibiotics.
Right.
Classic is ionophores, a class of, they technically are antibiotics, but they've never been used really any area of veterinary medicine other than some specific microbial modification or protozoal disease. In poultry, they're used strictly to prevent a parasite infection called coccidiosis. And they have no implications for human health or veterinary medicine at large in terms of disease control other than some very specific applications, some in cattle and some in swine and some in poultry. But there are no therapeutic drugs that these will create resistant organisms to. And there is no residue at all in the meat. I mean, the withdrawal time is such that there are no molecules of this drug in the meat.
It's really all antibiotic free by the time it gets to the meat case.
It's all antibiotic free. Yeah, absolutely.
Yet some people are paying more for one brand because it's raised with
And
antibiotics.
of course, the issue that is raised is resistance to, if you create resistance in animal pathogens or animal microflora, could that transfer to humans, to pathogens of the humans, and through the microbes, not through the antibiotic residue. And that's the argument on that side. And it's not impossible, but compared to physician overutilization of these drugs, it's an incredibly small event. It's not even really an issue. But that's not a big issue. But when it becomes a big issue is humans don't do well with shades of gray, in my opinion. And there are probably some therapeutic drugs that have been removed from the market for use in poultry and other areas of animal agriculture, where you would not want a zoonotic pathogen, for example, to become resistant to that drug. I personally wouldn't fight that. However, there's these other major classes of very old, very useful, very safe drugs that have no implications for human health. And to put them all in one basket is ignorance, in my opinion, foolish.
And you mentioned the ionophores, and you're right, they're used only in animal medicine, yet to raise birds without antibiotics, that means not using the ionophore. And of course, there's not going to be any antibiotic residue in the meat anyway, but you talked about the transfer of resistance. And, again, if you're talking about an antibiotic that is specific to animal medicine, such as ionophores, would that be any level of concern with something like that?
Those classes of drugs, absolutely not.
Yeah.
And there are many other examples of drugs that are not of human clinical significance, and to take those away and reduce animal production efficiency, to utilize more grain, to cause more suffering and more mortality, that's criminal. To me, it's against ethical conduct with raising animals, from my perspective.
Well, I've really enjoyed getting your input on sustainability. It's extremely helpful. We've been talking to Dr. Bill Hargis at the University of Arkansas. Billy, thanks again for joining us.
Thank you.